thanks for taking the time to talk to me today.
No problem.
I just wanted to have a little chat with you about your role in your workplace and the type of communication skills you use day in, day out. So whereabouts do you work?
Well, I'm a registered nurse. I work at the Holy Spirit Northside Hospital. I work casual through the hospital, so I do work out throughout the whole hospital.
Oh, right.
But recently I have started working regularly in the endoscopy unit. I just really enjoy the work there. I seem to have clicked with the people, and it's fast paced, and I like that sort of stuff.
Right. So what does the endoscopy unit entail?
Well, it's a day procedure unit, so people come in for a procedure. They come through admissions. They then get taken through to a bed where they wait for their procedure. They get taken into the procedure room where they're sedated, they have the procedure, then they come to the first stage of recovery. That's the section where I work, mostly. Then they get moved on to a second stage of recovery where they're discharged from there.
So you're in the intermission from post-operative to just before they get released home?
Yeah, that's correct. So when they come out from their procedure, they're usually quite sedated, heavily sedated.
Right. And so do you find you have to use specific skills to help bring them back into consciousness or anything?
Obviously every patient that comes out from their procedure is at a different level of consciousness. So it's my job to make sure that they are rousable by the time they need to move through to second stage. So I keep them from approximately 40 minutes if they need longer. Yeah,
it's a bit quick actually. I thought it'd be a bit longer.
No, it just depends on how people wake up. So when some people come out, they're quite heavily sedated. So I find that they need quite a bit to come around, and to do that, I usually get down near their face, use their first name, touch their shoulder. Some of them you really have to give them a physical sort of shape.
Oh, really?
Yeah. I use their first name, they tend to respond to their first name, or if they have a nickname, I tend to use their nickname, and quite often the admission girls will record a nickname, which is really handy for us who's trying to wake them up. So that helps them to, some people when they come around can be a little bit confused and disorientated.
So you're also not only using probably close personal skills with the patient, but you're also working quite closely with your colleagues, making sure that you know the patients that are coming through and...
Yeah, for sure. So we have a list that we work from, so we know sort of what's coming out, and quite often it's a really close team. So if they have somebody that's coming through the admission area that's really anxious about a procedure, the girls or the boys that are admitting them will pop out the back to us and say, hey, we've got this person, they're really worried about the procedure, or even the staff that are in the procedure will let us know. So we can adapt our care for them according to how that person, what we might expect.
Yeah, how they're going.
Yeah, and some people take a lot of reassuring and they're quite confused, so they want to know what's happened, is it over, and that's my first words to them. Hi, so-and-so, your procedure's finished, you're in recovery now, it's all done, you've done really well.
And then how it went too.
Yeah, so and sometimes people need to hear that 10 times before they're actually conscious enough to actually recall it.
Comprehend what you've said.
And a lot of people want to know their results immediately. So, and that can be quite challenging because I don't always have the answers.
Yes, true.
I wasn't actually in the room, so I find with people like that I just remain calm, tell them, I try and tell them the truth.
Yes.
I wasn't in the room with you, but your doctor will be coming to speak to you before you go home today, and you'll be able to ask any questions. Of course, if there's questions that they do have, that I can answer, I will certainly let them know. And a lot of people have a lot of instructions that they have to go home with, so I can actually start that procedure then, and that reassures people that everything's going in the right direction.
But you're keeping the whole process really honest, and honesty is the best policy, so that they're really feeling comfortable. And
obviously we're observing them, that's a big part of it, and we're listening to them as well. So we're asking them lots of questions that we sometimes we need them to rate us, like give us a pain score or a nausea score, or are you warm, are you comfortable, do you need another blanket? And by asking them questions that are simple, because these people have been sedated, they can answer them, and I can assess them according to their speech, I can get them what they need.
So not just verbal, but also assessing how they're looking as well. So
absolutely.
and whatnot if they're...
So I need to, physically touch them. I need to keep eye contact with them so that they trust me.
Very good.
Cool. Yeah.
Very good. Well, thanks for taking the time to talk to me today.
No problems.
And learning about what you do in your workplace.
No worries, Ellie. Anytime.
Thank you so much.